Hi, my name is Jess Burke, and I'm the Director of Marketing and Communications from the International Society for Heart and Lung Transplantation. And I am here today to share a little bit more about the ISHLT and ICCAC VAD Coordinator Career Development Award. This award is presented together by ISHLT and the International Consortium of Circulatory Assist Clinicians and is made possible through funding by Medtronic. And the purpose of the award is to develop the role of a VAD coordinator in mechanical circulatory support programs around the world, specifically by funding outstanding studies proposed by applicants to the program. Today, I'm honored to be interviewing Karen Meehan, who won the award last year in 2020. Karen comes from the University of Chicago Medical Center, and her project explores outcomes of virtual VAD follow-up visits, especially in the post-COVID era. Karen, thank you so much for joining me today to talk about your work over the past year.
Thanks for having me.
So to get started, why don't you tell us a little bit about yourself? I know I shared your name and your institution, but tell us a little bit about who you are, where you work, and what your role is.
Right now, I am an advanced practice nurse and VAD coordinator at University of Chicago. I've been here about 2 years now. I've been a VAD coordinator for about 10 years at different hospitals in the city. And right now I'm working in both the inpatient and outpatient setting with durable VADs and acute temporary support.
Great. Well, how did this idea for a project originally come about?
So when COVID came in March of 2020, everybody made the immediate shift to telehealth. So people couldn't come to the medical center, and VADs, as you know, need ongoing care. So we pivoted to telehealth as well and tried to do everything remotely. So we gave telephone visits or video visits to all of our patients needing ongoing follow-up. And then some patients didn't want to come back to the medical center, and they had fear of returning to a hospital campus just with COVID. And so we wanted to be able to continue to offer that to them if that's something that they preferred. So we had no data to say whether or not it would be okay to continue long-term VAD follow-up remotely through telehealth versus bringing people back to the medical center for a traditional outpatient visit. So we really wanted to look at if we compared them and had the exact same components in a clinic visit, both in person compared to a telehealth visit, if the outcomes would actually be the same. And if that would be a long-term model that we could follow for patients who either lived far or just preferred not to be seen in person.
That makes sense. And the timing was certainly extremely fortuitous. So can you go into more depth about the study in terms of what exactly you've explored and how? I know it's been a lot of things have changed since March 2020. So give us an update. Where are you?
So with the grant, we were fortunate to conduct a prospective randomized trial. So we were able to randomize 1-to-1 at the time of consent, whether or not a patient would be in the in-person traditional arm or the telehealth virtual arm. And those who were randomized to telehealth were provided with a tablet they could take home, a Doppler for blood pressure, and an automatic blood pressure cuff. So they have all the tools that they would need to conduct their clinic visit remotely. So we would then conduct the exact same aspects of a clinic visit, whether they were in person or virtually from home. So once they were randomized to the study and entered into the study, we're going to follow them for 1 year. And adverse event rates will be tracked, such as drive-line infection, GI bleeding, thrombosis, stroke, and their readmission rates. And now that pumps have continued to evolve and are doing better as far as lower adverse event rates, we were hopeful that following people remotely and being able to conduct the same types of visits would lead to similar outcomes.
So now that you're about a year into the work, what do you see as the relevance of the potential findings of this study? I know you're still in the process, but what kind of clinical and research applications do you see coming from the work?
Well, we're hoping that if it does come to be that the adverse event rates and the readmission rates are similar and possibly patient satisfaction goes up, that we really can create a model for long-term patient care that is entirely telemedicine or remotely, just because it would give more access to patients who didn't necessarily want to come in. Also, VADs are quality of life devices to some extent. So they get this device to be able to stay out of the hospital, say, enjoying their lives closer to home. So if this is something that we can prove is safe and effective, then it's one way to enable our program and any other program to craft a very similar routine management model that's all remote.
Can you tell us a little bit about the team you're working with on this project?
Sure. I have the never-ending support of Dr. Jeevanandam and Dr. Sean Penny. Both of them have been so helpful in everything that we need for this research study. And it's really a nurse-driven study. That's why it's been really great. Colleen Labune is our program director, and she has helped every step of the way administratively and getting us everything that we need. My study coordinator is Annalise Chinko. She is in her DMP program. She is a brilliant nurse coordinator for us who does all the education. She's done all the REDCap database information and entries. She's really keeping track of everything involved in the study. All the adverse event rates, everything is tracked by her. So she's been absolutely instrumental in this. And then Daniel Rogers, who is our manager of cardiac and vascular surgery research, has done an excellent job keeping us on track, keeping the research sound, looking at statistics. So I have a great team, and all of the VAD coordinators who conduct regular clinic visits are a part of the study. So they would see the patients virtually or in person according to their schedule. They've been so flexible and so great to just go with whatever we needed with the study. So it's really a team effort.
Yeah, there's no way to do this without a multidisciplinary approach. So it's fantastic that you've had so much support.
Yep.
Well, thank you so much for taking time today to talk about this project with me. I know you're still in process, so we'll have to find a time to connect once the results are out and see what the next steps are. We're really excited to see more outcomes of the study very soon.
Thank you so much.
Thanks for joining me, Karen.